segment is sponsored by VCU Massey Cancer Center.
The doctor is in and you have questions. November is Lung Cancer Awareness Month, which is the perfect time to learn more about lung cancer, effective screening options, and how it can be managed. Dr. Patrick Nanasenkom, pulmonologist at VCU Massey Comprehensive Cancer Center, is here to tell us how Massey and VCU Health are leading the way in treatments and clinical trials for lung cancer. Thank you for being here, Dr. Nanasenkom.
Good morning. Thank you for having me.
I have to ask, what is lung cancer and what are some of the risk factors?
Sure. Well, lung cancer represents an abnormal growth of cells in the lung. And that abnormal growth can occur anywhere from in the windpipe to somewhere within the lung. It's important to note that lung cancer represents the #1 cause of cancer-related deaths in the United States. And it's actually second among men and women within the United States. Importantly, lung cancer has many drivers or many causes. The primary cause is actually, as many know, cigarette smoke, but there are many other causes. We actually recognize now that your risk for lung cancer may be attributable to many other factors, ranging from an occupational exposure such as asbestos, or family history. If you have a first-degree relative who has lung cancer, your risk might be increased, as well as radon and also pollution.
So are there ways to prevent lung cancer and detect it early?
While there aren't any major ways to prevent lung cancer other than, of course, quitting smoking, there are certainly ways to detect it early. We now know over the last 10 years that there are certain people who are at higher risk for developing lung cancer. For example, if you're between the ages of 50 to 80, if you've smoked the equivalent of 1 pack a day for 20 years, and you either actively smoke or if you quit within the last 15 years, you are eligible to be screened for lung cancer. What does screening look like? It's very simple, actually. It's just what we call a low dose or low radiation CT scan. It does not require any IV dye, and it takes about 2 minutes and can actually save a person's life.
Is lung cancer treatable, and what are the options for it?
Absolutely. Well, it turns out that over the last 10 years, we've made significant progress in lung cancer treatment. There was a time at which lung cancer was really treated with either surgery or radiation or chemotherapy, and those options were limited. You fast forward 10 years, and now we have at least 10 targeted therapies for lung cancer. We have immunotherapy. We have advanced surgical techniques. It's important that any patient who's being considered for lung cancer treatment have a multidisciplinary team. And we at Massey, we really pride ourselves on having a team that consists of surgeons, pulmonologists, radiation oncologists, medical oncologists, all of whom work together to try to ensure that a patient gets the best therapy for them.
Talk to me about clinical trials. Are they an option for patients with lung cancer?
Absolutely. In fact, lung cancer really is one of those cancers that has been leading the way in terms of clinical trials. We would not have the multitude of targeted therapies, the advanced surgical techniques, the advanced radiation therapy techniques without clinical trials. Massey really prides itself on being on the leading edge of clinical trials. And so I would encourage any patient who is under the care of a medical oncologist for their lung cancer to consider clinical trials. And I would be quite certain that they'd be able to find a clinical trial at Massey.
Those are tomorrow's treatments today. Thank you so much for joining us today, Dr. Nanasenkom.
Of course, it's my pleasure. Thank you for having me.
For more information on VCU Massey Comprehensive Cancer Center, give them a call at 804-628-6430 or visit the website masseycancercenter.org. Stay with us. Virginia This Morning returns after the break.